দেশ বিদেশ, জাতীয় আন্তর্জাতিক, রাজনীতি থেকে খেলা, শিক্ষা থেকে সংস্কৃতি, সব খবর পেতে চোখ রাখুন শুধুমাত্র নিউজ প্রাইমে। আমরা সত্যি লুকোই না, আমরা সত্যি দেখাই। সাবস্ক্রাইব আওয়ার চ্যানেল ফর ফার্দার আপডেটস।
স্যার ডান দিকে আসুন, নীল সাহেব স্যার।
স্যার আপনি এদিকটা চলে আসুন। স্যার আপনি
বার হয়ে যাচ্ছে।
আরেকবার করাও, আরেকবার করাও।
Minimal symptomatic stage, then this to the advanced stage, which the life becomes very threatening, and we have to intervene in the early stage. When it is advanced, we can't do anything. So the purpose of this World Kidney Day celebration, or this what you can say globally, is how we can make people aware regarding the silent nature of the disease, how we can make the disease diagnosed early, how we can take some necessary steps so that we can protect disease. What are the newest sciences and the newer, scientific development, newer technologies, everything that are coming forward to keeping everything conglomerated in this space, this World Kidney Day celebrated. But ladies and gentlemen, for us, the kidney day is not only one day. Every moment we live with the kidney problem. So this is a token celebration, but we are celebrating kidney disease, prevention of kidney disease, mission for kidney disease day in, day out. With this brief note, today we have some specific agenda. I'm really honored and really proud that a lot of dignitaries today sitting in the front line, Professor Dilip Boito, the Director of National Institute of Technology, Silchar, with whom we are the collaborator. We are developing a lot of innovative work. AI involved dialysis machine is the one project we are doing. We are developing some of the very beautiful work. Organ on chip, some of the project we did with the Professor Kaushik Guho. Professor Kaushik who is also with us. Professor Dilip Boito has a very illustrious career, having a civil engineering from Shibpur B College, and then he served as a professor for the IIT Kharagpur, and he had a lot of administrative posts and serving for more than 40 years of a wide, vast experience. Such a luminous character, such a luminaries are present today. We'll talk about the integration of the technology in the field of nephrology, and we are collaborating in some of this. Please give a big hand for Professor Dilip Boito. Along with us, we have Professor Sadhan Chandra Roy, the ex-sheriff and the pioneer of the cardiothoracic surgery of the city. Sir is like our grandfather. Every aspect, every field of medicine, every steps we take opinion of sir. Give hand for the sir. Today with us we have Professor Kaushik Guho, and Professor Kaushik Guho is one of the most rising star in the field of engineering. He's from the NIT Silchar. I know his scientific acumen, the research intent, the work he's doing, And I had the good luck and opportunity to collaborate some of the research work with Professor Guha. And in the kidney on chip, organ on chip projects we worked. And also we worked in the bioartificial kidneys. Professor Guha will speak something about us in today. And in the front line, to my left, there are the peoples who are the epitome of health. Those are the peoples from the sports science. I have a Dipendu with us, the famous footballer, Mr. Prashant Chakraborty, the famous footballer who was once upon a time raiding the field. And along with us, we have Mr. Baldo, who was a famous swimmer who crossed the English Channel. And all of them, I'll request to come on the stage just for felicitation on behalf of the Kidney Care Society. Sir, please come on the stage once.
আপনার হাত ঝুঁকলে তাও না না কেন স্টার্ট ছবিও যাচ্ছে না একদম স্লো
opportunity to inaugurate the unique Nephro Care app today. Ladies and gentlemen, they are designing this Nephro Care app. So, just to give a context, the thousands of the patients who are suffering from chronic kidney disease, who needs continuous care, who needs continuous monitoring of their blood pressure report, blood sugar report, intake, output, everything, and need to be communicated with the medical team, it often becomes very difficult without a system-driven process. So our IT team has developed this Nephro Care app, NCIL app, which is one of the very unique app. And through this app, a person will be connected to the care team 24/7. The purpose of this app is, this app will track the blood pressure. The app has a facility for integrating continuous glucose monitoring for the diabetics. Anybody can input his intake output charts, his blood reports, and everything will be connected to the entire Nephro Care system. Ladies and gentlemen, sorry to say, my wife, Dr. Sutapasan, is right now present. I'll request Ma'am Parvati to come in the stage, please. I'm not skinny, sorry. Okay, so this app will have the facility to monitoring the every patient, their all the medical data, lab reports, and the trajectory. And this World Kidney Day, I take the opportunity in presence of the director of NIT Shilchers and the coaching, all the technocrats, and with the medical people. Let's open this Nephro Care app, which is going to change the horizon of the patient care with suffering kidneys. Give a big hand, please, and I'll reference sir to please open it.
সেন্টার হলে ভালো হবে
দাদা একটু সেন্টারে আনুন একটু লেফট সাইড হয়ে যাবে বসে যাবে
দাদা সামনে একটু এদিকে
telephone number only, you will get an OTP and you will be into the app, and this app has the facility to tracking everything. Ladies and gentlemen, this app is not simply the medical monitoring app, it also gives a lot of advantage in terms of other services. For example, you can book your medicine, you can book your lab test, you can book your appointment, everything can be done through this app. So I believe this app is going to change the trajectory of kidney care in the coming days. So thank you very much, and right now it is the time to call our chief guest, Professor Wbolpage, to come on the stage and speak something and give some good blessings to us, so that this our mission for preventing kidney disease and integrating technology with the upcoming days where the medicine and technology is working together. I want to listen from you, sir.
Good afternoon to all present here. I am actually, since from technical side, I am somewhat mismatched. Only relevance actually nowadays, every branch of activities is having some of other technical intervention, and medical science is not the exception. And particularly some of my colleagues, those who are handling electronics, computer science, instrumentation, they are very, very well connected to this medical science. Being I am a civil engineer now, I am little disconnect, but and sometimes engineers versus doctor, when we have no comparison, who is superior and who is not, many times there will be counter argument, and sometimes engineer pose they are superior, and then doctors also give a point that can you do any repair work in a living condition, in a running condition, for example a vehicles or a machines or an AC or anything, any equipment. So there actually the doctors are superior because they have to repair the system in a living condition. That is the superiority. Actually, you cannot do that because when you have seen that there is mechanical shop, near mechanical shops, there will be different parts. Then there will be winding these and spreading here and there, and then finally they will assemble. That is the way they do. But doctors that do not have that chance, that opportunity. They have to keep the system running, and they have to do this. And if you talk about that civil engineering, initially I told that high-tech engineering department are very closely related. Civil engineering may not be that connected. But one way actually, civil engineer play close to doctors. Why it is so? You can see the buildings, people are living, but you can repair it. Road is open, but still you repair it. And when it is a running condition, this type of work when you do separately, the quality will be different than a running condition. Quality little different because for everything we need to follow certain standard, but when you keep the traffic open and do the work, some standard you have to sacrifice. So as a result, longevity and all will be affected, and people will be telling always that civil engineers always siphon money because of this quality. There is that part is there, but there is another part actually when you do in a running condition, quality maintaining is little difficult. So that way actually I can say that civil engineering is quite close to doctors. Like nowadays, no, not only I am giving very simple example, but there are some example nowadays. Building sometimes is going underwater, and then what we do, we can elevate. Now the technology is there, we can lift it, even we can shift it also. So like that, and we have to take care, and he has to survive maybe 60, 70 or even more years without any manual. So actually, when actually doctor, professor, etc. was not there, that time actually naturally they used to manage and they used to survive, but with complexity, people are dying and then started how to survive. And as a result, no, these are all medical profession. Obviously, definitely you know better than how based on observation, because you don't know actually exactly perfect, you don't know. You only observe, and based on that you list certain things. If this happens, you have to do this. If this happens, you have to do this. So like that. So there is no, there may be nowadays some ultimate solution. Otherwise, doctors finally prepare the manual. That right from beginning for any appliances you get manual. Now doctors actually may not be fit to him, but there is a general manual. So you have to, if there is it goes wrong something, then how to manage it. So that is the way, the challenge to the doctors, and they are doing. And next point actually, even though in the medical science everything is now technology.